think it's very important for your viewers to understand the numbers we have today. First of all, they're underestimates. So if you take the total number of positive confirmed cases, you multiply it roughly by 10 to get the number of actual cases, or you take the number of deaths and you multiply it by 800 to get the actual number of cases. But that actual number of cases reflects what happened 15 days ago. Someone who's unfortunately died got infected 15 days ago and then deteriorated to die. So we're 2 weeks out of date by whatever numbers we're seeing. And that's why it really reflects a much larger number of cases, a much larger number of deaths that are going to happen here. And that is what the fundamental problem is. And people who say, well, we can't tank the economy to save lives, I think the economy is going to be hobbled unless we get our hands around this public health emergency. So I think they have it backwards, which is let's save the economy and then we can deal with the public health emergency. It's just the reverse. Let's deal with the public health emergency vigorously and quickly. But every day that we delay, physical distancing and actually making it prevalent throughout all 50 states is a day that we delay actually solving this public health emergency and being able to get the economy moving again.
We're listening to Dr. Zeke Emanuel here walk through some of the numbers. And for viewers watching here, 6:08 p.m. on the East Coast, we're seeing some of the members both of the task force and the administration step out to the lectern. This briefing, again, just for folks to have an understanding, is running about 40 minutes behind. They've been holding these briefings earlier in the day. This is now going back to what is, for the Washington audience, more of an evening briefing. Viewers will also notice Attorney General Barr is up by the White House lectern. That's an addition today that was scheduled. We knew that was coming, but we're waiting on Vice President Pence and some of the other folks who typically come out, and we'll bring the briefing live when we do. One more question for the doctor, and then I'm going to bring in Michael Steele. But doctor, what you're saying in plain English is that you cannot understand or make threat assessments here today without folding in the 2-week delay, which means some of what we're seeing will statistically get
Correct.
Worse based on what we know. How does that square with what we heard from what I just showed from the president? He seems to be speaking as if things are frozen in time and you can now pull back from the health precautions and get back to, as he put it, helping the economy. You're saying that whole frame is basically wrong because today is not frozen in time with regard to the cases.
That's right. We are going to get much worse before we get better. And one of the things we need to know from testing, which we can't know given the kind of testing we have, is when the number of new cases is actually going down and getting close to zero. That'll be the time when you can peel back some of these restrictions. But you can't peel it back while you're still having a dramatic increase day to day in cases. You can only peel back those restrictions once they have gone to zero, or as we people who are in the epidemiology field say, once the percent of the population with coronavirus plateaus. And there's no indication that's happening. We're every day seeing it go up and up and up. So
right.
We are definitely behind the 8 ball. And one of the consequences you hear from New York, Seattle is they're going to, be overwhelmed. More and more patients are going to come, even if it's only a small percentage of the number of people infected, and they won't be able to handle them in the hospital. They won't have enough ventilators for them. They
right.
won't have enough masks and other gear to actually treat them effectively. And
right.
that will mean people with other illnesses, whether it's cancer or heart disease, will be not get the care they need.
Hey, I'm Ari Melber from MSNBC. You can see more of our videos right here, or better yet, subscribe to our YouTube channel below. You could have been anywhere in the world, but you're here with us, and we appreciate that.